Welcome, everyone, to Pharma Talk. We will focus today on optimizing pharmacy workflow. My name is Carly Traylor. I am a VP Pro for our South Central region. I work under the McKesson Health Mart brand, and I help our customers and our sales team to act as a business consultant for all of our services. So you've probably had me in some of your stores. If not, I'm so excited to get to meet y'all and spend time with you during this McKesson Idea Share. But I am joined today by Jenny. So Jenny, tell us a little bit about your practice.
Yeah, hey, so my name's Jenny Powell. I work for Gibbs Pharmacy in the clinic at Gibbs Pharmacy here in Lebanon, Tennessee. We're only about 25 minutes east of here. And I'm actually a lead clinical pharmacy technician. And so earlier this year, at the beginning of April, we opened a clinic that is attached to our pharmacy. And so I manage all the clinical services there alongside my pharmacist, Alyssa. And in addition to being a certified pharmacy technician, I'm also a community health worker, a diabetes community care coordinator, and a nutrition coach as well.
So the topic that we want to focus on, or the service we want to focus on today, is Test to Treat. So tell us about what that service looks like if we were to walk into your clinic.
Yeah, so the clinic at Gibbs Pharmacy is a private, comfortable setting. It's kind of set up like a doctor's office, so we're able to meet the patient in there. They get to be in a private room for that point of care test or whatever other clinical service that they're doing. We do have some ability to medical bill, so when the patient comes in and does that intake, we'll have them fill out the form that they need for whatever that point of care service is. And then if we have their medical insurance, we can look and see if we're contracted with that. If not, then we have that conversation with them about what the cost of that service is going to be, get them to okay everything. We bring them back, take their vitals, put them in a room, and then depending on if the technician can conduct that point of care test or if it has to be with the pharmacist, then we will go in, collect the sample, and run the test, and then that pharmacist goes in and does their consultation. And our pharmacists, we work with collaborative practice agreements with a physician, and we have recently, last year, an expanded scope of practice for pharmacists in Tennessee State, which is really great. So we're able to prescribe medications based on those point-of-care tests. So it's really convenient, a one-stop shop for our patients because they don't even have to leave the clinic. We can walk over to our pharmacy setting, dispense that medication, and check them out all right there.
So really, you've taken the fact that pharmacists are the most accessible healthcare provider, and you've married that with the blueprint of a walk-in clinic.
Yes.
And so you brought those two worlds together to meet the need of your community. Now, when you are doing these Test to Treats, go over those specific tests that you're targeting.
Yeah, so right now the point-of-care tests that we're offering include, of course, flu, COVID, strep. We are about to start providing RSV tests. We're able to do UTI testing, and we are doing A1C and cholesterol as well.
So things that are very common, very run-of-the-mill, things that like you don't necessarily want to have to make an appointment with your doctor, that maybe the doctor is even like, we are overloaded.
Yeah.
Like, we would like to get these cases off of our
Yeah, absolutely. And I mean, I think it's important to say that we're not trying to replace the primary care provider by any means. I know that like when we initially opened the clinic, there was some conversation around that, and we were really clear with our local providers that we're not trying to replace you. We're just trying to bridge a gap in healthcare services for patients. And there's a lot of patients too who maybe don't even have a primary care provider, and you can also help reduce like emergency department visits for some of these things. And that's where we're really trying to meet that need.
So go back to when you were setting this up. What were some of those initial steps when you were trying to integrate this into your workflow?
Yeah, so we have pretty much always offered point-of-care testing in some form or fashion. For me, when I started back in 2020 during COVID, you know, we were like going out to the
baptism by fire.
Oh yeah, oh my gosh, trial by fire. My very first experience in pharmacy was like 1 month in on the counter, and then COVID happened.
Yes.
So we of course were doing these point-of-care tests like even at the cars along with immunizations and all that. But at that point, we were still operating just within the retail pharmacy. We didn't have that clinic expansion. And really the way that was integrated was just we had a couple of staff members, pharmacists and technicians, that we got them trained to make sure that they understood the point of care tests and like all the compliance things that go along with that, making sure that our CLIO waiver was up to date. We did have to have that collaborative practice agreement at that point with the doctor in town. And so we really just would have patients come in, they said that they needed it, we had them fill out the form, and like we ran it. Now that we have this clinic integration, we're able to be a lot more nuanced in the way that we handle things, and we're really able to give that patient a lot more time and attention.
Yeah.
And I think that it promotes a better patient experience for them, and they're going to continue to come back to us for the other services that we offer too, because now they've seen us, they know that we offer all these other things, and it gives us the opportunity to address so many different issues.
Yes.
Yeah.
So you touched on some of like the CLIA waivers and the compliance. I want you to go back to the payment side. So tell me about the credentialing and the contracting side of getting paid.
For like medical billing?
Yeah.
So that is a really hot topic for the last couple of years, and we're definitely still new to it. It is something that we have been like diligently trying to get handled for years and years. And I mean, there are companies out there now that will help you with the credentialing and contracting practice. And there's companies that do that and companies that give you software programs for like soap notes and billing, and then there's some that do both of them. And I think like the biggest takeaway that I would want you guys to get from this today is that like there's so many different companies out there offering you things. You need to talk to all of them, and you also need to talk to other pharmacies and pharmacists who have been through this, because we've been burned by some before, unfortunately. And I think what is going to be best for your practice is going to be specific to each location, right? And so you really want to get all of the information that you can before making a decision. It's even been so much so that like our pharmacist, Alyssa, and myself have taken it like on our own to try to get some contracting done, because we had like a particular company that held all of our contracts. Yeah. And that can be, you know, really devastating, especially when you're trying to get a program like this up. But it's just more time consuming than anything else. You just need to have tenacity and you know, be dedicated to making this work for you and your community and your patients. It's more just time consuming. It's not really terribly difficult to do. It just feels like banging your head against the wall sometimes, because they want to reroute you to the pharmacy because they don't understand that you want a medical contract.
Yes.
You know, it's just working your way through that.
Yes. And what I'm hearing from you is that you can't grow as an island. You have to have a network.
Yeah.
And I also want to remind the crowd that we're talking with a technician here, an incredible technician.
Thank you.
That like, this isn't all on a pharmacy owner's shoulders, right? You have to leverage your team members. And I loved what you just said, like reach out to other pharmacies that are trying to do this, get their feedback. Talk to multiple companies. Don't just put all of your eggs in one basket, like all those cliches.
Yeah, I think that now there are so many resources, whether it's your state pharmacy association or whether it's like a trade or professional organization, and you really have the opportunity to connect with people so easily. Like just start asking questions, because you know, now you'll meet people who have been doing it a different way for years and years, and they're really successful, and you can take a look at their model and see like, oh, well, will that integrate well with my pharmacy practice? And then like see how they're using their technicians. You know, different states are going to have different types of authority and different laws, and you know, for us in Tennessee, the Board of Pharmacy is moving to expand what technician roles can do. And I would just encourage you to be like really well versed and well read on what your Board of Pharmacy allows your technicians versus your pharmacist to do, what constitutes direct patient care. And then if you don't like it, go advocate for it. Like go to the Board of Pharmacy meetings. Jim and I went to a Board of Pharmacy meeting earlier this year because they're looking at expanding that role for certified technicians and allowing them to do all immunizations that are approved by the FDA across the board, and to be able to do all point-of-care tests. And it hasn't passed yet, but right now we're lucky enough that we have a waiver for some of those things, so I can still operate and assist my pharmacist in a really meaningful way. And there's just so much more opportunity out there for that. You just have to ask. Yeah.
Yes. So we've talked a lot about like what your practice looks like now, how it got to where it is. Where do you see it going? Like, how do you want to build this test to treat?
So to start off right now, I think that we really just need to get more practice in medical billing. It has been such a huge take-on task for myself and our other technician. And it's really interesting because like when you have one of these companies that's doing the medical billing for you, you're not seeing that coding on your side. Go learn about the coding, like learn about the CPT codes, learn about the diagnosis codes. There are portals like liability and stuff like that. And some payers give you like a cost estimate calculator, so you can start digging in and learning about those different things when your patients bring you those medical cards. And I think that being able to expand a technician role to where they're really well versed in medical billing, or where they at least feel more comfortable, can be super helpful for your pharmacy and super helpful for you, especially when you're having these conversations with different companies. And then, for our A1C testing and our cholesterol testing, we also offer like health coaching programs and diabetes education services. And while those tests might not be something that you can directly prescribe a medication for, it is a measure that you can then provide back to that primary care provider's office, or that I can use to say like, hey, let's track your A1C over the next 12 months while you're in this program. And we've seen some really great outcomes with those things. I mean, when you partner that point of care test with that education component, we've had patients who have dropped their A1C from like an 8% to 5%, which is amazing.
Huge.
Yeah, such a big deal.
Absolutely huge to their overall care.
Yeah.
So I have one more question, and then I want to turn it over to the audience. So y'all be thinking about questions that y'all want to ask. You threw out an acronym earlier, CHW, Community Health Worker.
Yeah.
I think this is such an incredible tool. It was thought up in a public health test tube, thrown out into the community with no business model, and it landed in the laps of pharmacy technicians. And you've been through the training, so talk about it a little bit more and how it's impacted your career trajectory.
Yeah, so I think that the CHW training gave me such a big perspective, and actually, so this is a little bit like off topic, I guess, but so when I first came to pharmacy, it was like not the role that I originally, like not the career path I thought I was going to take. And so like I had been in school and COVID happened and I dropped out of school, and have worked for Gibbs since 2020. And then when I took the CHW course last year, it just opened up so much more opportunity, and not necessarily that we're there with like billing medically for it, which I think we will be sometime in the future, fingers crossed, I think we're moving there. But just, it really opened my eyes to like different public health crises and being able to meet patients where they're at. And now I have these resources like within our community that I can refer to them, and it helps build on that trust and that relationship that you have with your patients in a pharmacy setting. And so they're going to continue to come back to you. And now, for me personally, that's encouraged me to go back to school. So like finishing my bachelor's degree and like maybe more in the future, who knows. And I think that it really opens up a space for the health educators in pharmacy, because your pharmacists are already health educators and you're oftentimes not getting paid for it, and you should be, okay? And to be able to develop a role where you have a technician who is able to support your pharmacist, like CHWs can provide education. And so where your technicians can't counsel, there are certain nuanced things that a CHW can do. And put on the CHW hat. And recently within the last year, I've helped people get connected with food resources. Like we have patients who come in all the time, I'm sure you guys do too, who they're deciding between paying a grocery bill and paying for their medication. And those patients can get really agitated, and it just takes talking to them and understanding what's going on. And so now we've helped people get set up on Meals on Wheels and with food banks. And recently we had a patient who she was in so much pain, had like leg and back issues, and she couldn't get to her phone, and she's on our MedSync department, and she wasn't filling her meds, and it was hitting our scores, right? And we finally got her on the phone with one of our techs, and she expressed the issue. I had a wheelchair over to her that day. Like we had a wheelchair there. Now she's compliant with her meds because she's getting to the phone to pick up the phone and talk to that technician and go over her medication. So it's just the impact is so expansive. And I think that there's so much more room for technician development and for pharmacist development and for you to establish yourself as a wellness center for your community. I mean, we talk about that all the time, but we don't really think about what that impact can really become. And it's changing. Legislative wise, things are changing, and it's time to get involved in that way.
Absolutely. All right, so let's turn it over to the audience. Any questions? Oh, okay, right here.
Hello? Yep. CVS and Walgreens tried the point of care testing, with the MinuteClinics, and it was a failure of epic proportions with them. They got clobbered.
Okay.
What are you guys doing different that is actually making it work that these billion-dollar corporations cannot?
So when you say that they're getting clobbered, do you just mean as far as reimbursement?
all closed down. Everything. Like I think half of it closed down in the state of Michigan.
Sorry, go ahead.
All the mini clinics in the state of Utah had to close down because they just weren't performing. I think half of it's closed down. Actually, more than 80% closed down in the state of Michigan, where I'm from. They're not doing it as effectively. They're not a success story like what you're telling. So how are you guys doing differently that actually is making it successful for your pharmacy?
Yeah, so I think that first of all, like as independent pharmacists know, like you have a much more oftentimes caring relationship, I think. And it's not to say that those pharmacists and technicians at like CVS and Walgreens don't, but you're talking about like this clinic. And I think the difference is that a lot of these patients have seen my face and seen my pharmacist's face in the retail setting already. So when we've expanded into this clinic, like they already kind of knew us. We were established in the community. I even go out into the community and I participate in like our community health council. And we really just listen to what the patient's needs are and we try to meet them at every single step, where I don't think that they're set up to be able to do that in a setting like a minute clinic, right? And so if I have somebody who comes in and they want a test for flu COVID and it tests negative, and then they test for strep and it tests negative, my pharmacist can go through those symptoms with them and say, well, like you're testing negative for these point of care tests, and so there's not something that I can prescribe for you based on our collaborative practice agreements, unfortunately, but like maybe it's sounding more like you have allergies or something. So like, let's go ahead and try this over-the-counter medication and check back in with me in a couple of days and see how you're feeling. And if not, like we can maybe retest, or we might go ahead and refer you back to your primary care. And I think that just the level of care and consistency and follow-up that we have with those patients, it takes a lot of time. It takes a lot of manpower, right? But we care so much about these people in our community, and we're so deeply embedded in the community in a different way than the chains are, unfortunately, for them, that I think that that patient care component is what keeps people coming back to us. And then on top of that, again, like when they're coming into the clinic, they're seeing all the different services that I'm offering in that clinic. And so that's not just point of care testing. I'm going over immunization gaps in their history, and like we're getting the pharmacist to counsel them on those vaccines, and they're getting them. We're doing for patients with diabetes, like the diabetes education classes, group and individual. We're doing diabetes shoe fittings that are covered by Medicare. There's so many different things that you can use to position yourself better for your community, for their overall health, that when you have someone who's coming in for a different service, then you can talk to them and address any other issues and say, oh, we might have a fix for that.
I also want to point out the depth of control that independent pharmacies have over their services.
Yeah.
So I want to emphasize the scalability of your test to treat program that started in 2020.
Yeah.
So this program has been growing since over the last 5 years.
Yeah.
And the clinic doors opened in April.
Yeah.
But
just
the
this
test
year.
to treat program started.
I mean, they
years
had the
before
test to
that.
treat program way before my time. I mean, Gibbs Pharmacy has been around since 1989, is that correct? God, you heard? Yeah, 1989. So long before my time there, and they've been doing point of care testing.
Yeah.
And I think that for us, the biggest push most recently, like of course the pandemic opened up, so much more opportunity for pharmacies because we were the ones that were still open when everywhere else was not. And now, like it's just getting diligent about continuing to expand those services, finding the right staff members who are excited about this kind of patient care and excited about making it work. And then, we're not having to worry so much about like the metrics. Of course, we want quality control within our services too, but where you have chains who have to constantly hit all these different metrics and things, and they're getting their pharmacists and their staff burnt out on it, like we're not doing that, so we can really focus on the patient.
And I think a good follow-up question to that is, how do you track profitability? Like, how do you measure success?
Oh,
with this?
yeah, that's a great question. So I think it's also important to know, like, we started with cash, just all cash services. This medical billing component is something that we have been trying desperately to get for years, and it's just now starting to work out for us. So I'm not going to sit here and claim to be a medical billing expert under any circumstances.
Right.
We're still figuring it out. And, like, even now I'm sitting here talking to you, but I'm going around this conference and asking other people, like, okay, what are you doing? How can I compare?
You're
like,
constantly
growing.
growing.
We just want to help each other, right? Yeah. And so we started with just the cash services, and patients still pay just the cash services. We're not recognized as federal providers for Medicare, and so our Medicare patients come in, and if it's more convenient for them to get that $50 like consult and point of care test with us in addition to whatever their meds are going to be, like they're still doing that because it's more convenient. They're in and out in like 30 or 40 minutes. They don't have to worry about waiting or like try to call their doctor a million times to get in. And so it is really scalable to whatever your needs are, and you can, start with that cash component and move upwards from there and work on the medical billing. And, as far as tracking goes, I just use Excel sheets. Like, I just do data sheets all the time and really try to, like, follow up with it. And, there's so many different portals. If you have a company that you're working with to medical bill, they should be tracking that for you. And if they're not, why? Like, you're paying for that service. Make them track it. But otherwise, I think if you put the power in your own hands and take the time to like make sure that you're following up on where those claims are at, you're going to know if this is working for your pharmacy or not.
Pretty quickly.
Really quickly.
Yeah. That was good. Thank you for that. All right. Next question.
Okay, so it's clear that you are operating at the top of your training and you're doing some really, truly amazing things, but how did it start for you? How did you foray from, a pharmacy technician counting and pouring and doing some of that operations work to then foray into some of this clinical work?
Yeah. So as I mentioned, I started my pharmacy career like a month before the pandemic happened. But so I just started, I got certified, I came into the pharmacy, they started me out in customer service, which, that's just how it goes. You got to cut your teeth. And started in customer service, moved my way up to the counter, just learned the ropes of counting and inputting and understanding insurance. And then our owners, Christy and Jim, identified me to maybe be able to take over our immunization clinics. And so at that point, we didn't have the PrEP Act. We didn't have any like really advanced immunization training for technicians, at least not in our state or anything. And so it was literally just handling all the billing, all the paperwork, and all the setup for immunizations. And that just, you're in the thick of it, especially in the middle of a pandemic or a health crisis or whatever. And you're learning all the things. And so I think that if you're trying to identify a staff member or a technician who would be good for a role like what I'm in right now, you want somebody who is interested, in like having an advanced role. And I think that we as a field need to be really diligent in expanding that opportunity for our technicians, because our technicians are going to be like supporting the pharmacists. We talk a lot about burnout and everything, and like I think that that's the key, is expanding that role of technicians for a career path, not just for a job that's convenient. And then you're going to have people who will want to continue down these advanced roles. Like I have all these different advanced certifications, and it's just because I care and I enjoy spending the time with the patients and being able to help my pharmacy with their operations. So, yeah.
I love that, because what I'm hearing from you is you have a professional identity.
I do, yeah. And it's something that I never really, when I started, I really didn't think about it. And now within the last the last year or two, I've really begun to think about like, what is my professional identity? Because when I go to like Board of Pharmacy meetings or to our State Pharmacy Association meetings rather, and I participate in that, there's not a ton of technician participation right now, but they're really encouraging it and they're really excited about it. And I think that being able to develop that professional identity is just going to help tenfold the pharmacist too. And so, I realize that like oftentimes technicians are forgotten about, and like I've literally had pharmacists tell me that before in different settings, that like, I forget about technicians all the time. I'm like, we're supporting you. Like, let us support you. Like, let us be the top of what we can be. Yeah.
Because I say this all the time, is that you can't continue to advance the role of the pharmacist without also advancing the role of the technician, or else you're going to collapse. The system is going to collapse.
Yeah.
And so I look at what you're doing, and I'm so excited. I know we're at the end of our time, but Jenny is going to stay behind and answer any questions that you might have. But just join me in thanking Jenny for sharing with us.
Thank you.